Welcome back to Sunday AM now. Non-alcoholic fatty liver disease affects people with type 2 diabetes, obesity and high cholesterol. If left untreated, this disease can lead to cirrhosis of the liver.
Today, awareness among patients is extremely low, and for that reason a campaign was launched by St James's Hospital and Liver Wellness to highlight the risks involved.
Joining us now is consultant hepatologist Professor Suzanne Norris alongside Kieran Lawless, who's living with non-alcoholic fatty liver disease. Good morning to you both.
Good morning, guys.
Thank you for coming in today. Suzanne, if you don't mind, we'll start with you. Can you tell us what exactly non-alcoholic fatty liver disease is? I must confess, I'd never heard of it before this week.
So by literally that definition, non-alcohol fatty liver disease, which is a bit of a mouthful, this is fat in the liver that is not due to alcohol excess. And many patients who have non-alcohol fatty liver disease will probably have a story where doctors have said, oh, your liver blood tests are a little bit up, you must be drinking, how much are you drinking, are you drinking too much? And that's Kieran can probably identify with that probably as well.
Because that's a traditional
flag.
That's
a traditional thing, that if there's fat in the liver, it must be alcohol.
Yeah.
But what we realised over the last 10 years or so is that there are other risks for fat in the liver that have nothing to do with alcohol. And this form of fat in the liver often happens in people who are not drinkers at all. So the risks for having a fatty liver, unfortunately, are things like living with type 2 diabetes, maybe your BMI being a bit high, so people carrying a little bit too much weight, particularly around here in the middle, having a very high untreated cholesterol for many, many years. And obviously people can have a combination of those three things that increases the risk of fat in the liver. And for the majority of people who have fatty liver, often the fat will do very little. It might be just it'll sit there, do nothing. So there's two things that can happen if you have fat in your liver. It does nothing, it sits there, it's literally simple fat, no risk of cirrhosis. And that's about 70 to 80% of people who have fatty liver. But the reason why we're here today, I suppose, is to highlight the fact that for 20 to 25% of people, the fat is a problem. And what happens then is the fat causes inflammation, it targets the liver, cells come in from the peripheral blood to attack the liver, and that inflammation and attack can cause fibrosis or scar tissue. And then the risk of cirrhosis in that setting is about 30% over a person's life. And you also then have a risk of liver cancer. So while the majority of people who have fatty liver, it'll never do anything, it'll never affect their health, it's that smaller 20 to 25% of people where it is damaging the liver and it's silent, they're not aware of it, it's not causing any problems, so you don't know about it.
You describe it as a silent epidemic.
Completely.
If we can come to your good self, James, and tell us about, you were diagnosed with diabetes a number of years ago.
Yes, I was diagnosed with type 2 diabetes probably 14 or 15 years ago. And that was relatively well controlled and without any great difficulties.
You managed it.
I managed it. Yeah. I used to go regularly to the diabetic clinic. I took some medications for it, and generally didn't take that much notice. One thing I did notice throughout the time was anomalies in the blood test results. And over a period of years, I watched these anomalies, and I had asked the consultant about them. And the reply, generally speaking, was that it was nothing to worry about. This was kind of common among diabetic patients.
But your mind was not at ease, though, because you were quite proactive.
No, it wasn't at ease, and I did feel that that it needed a bit more attention. Yeah. So eventually, I wrote to Professor Norris about it, just asked her, because she was doing a study in liver wellness, I think, at the time. And I sent some blood test results and said, would you have a look? And
yes, yeah.
And what was it delivering symptoms to you?
No, there are no symptoms.
And interestingly, so it was merely just curiosity in those results, saying something's not right here.
Yeah, I was curious about the results.
Yeah.
And I wasn't really happy about the response to it. I thought it needed a little bit more attention than that. As it happened at the time, I'd moved over to just after we'd done the tests and so on. I ended up doing a biopsy at about the end of 2013, and in early 2014 I took a job in Glasgow. So at the time I was doing a lot of medical stuff, because I was joining BUPA and stuff like that. And none of that showed up anything unusual. Really, as well.
But when you did get the diagnosis, was it a complete shock then?
Yes.
For NAFLD, because you'd been told all along you were fine.
A complete shock. It came right out of the blue.
So what did you decide to do about it? Because you completely changed and overhauled your routine.
Well, having sort of reviewed this at the options here, the choices seemed to be, there was no obvious medical sort of intervention that you could do, unless you were going to get a transplant.
Okay.
So it seemed, that regeneration of the liver is is quite a well-known phenomenon, that it has a very high power of regeneration. Having said that, if the cirrhosis had already taken place, you didn't have much chance of that.
Yeah.
But I thought, what I can do is to mainly diet, to actually sort of, to give it the best chance of recovery. I'd work on a diet that was very gentle on the liver, to kind of give the best chance I could do to regenerate and recover. In order to do that, I took a view that the medications I was taking for diabetes were also kind of toxic in side effects and stuff like that. So I needed to control the diabetes, but by means of diet and exercise, as opposed to
And did you manage
medication.
to come off the medication, Kieran?
Yes, and I monitored it very carefully. I did my bloods, 20 times a day or whatever it was, but a lot of times, and checked it. Took up a very serious exercise program, and worked on the basis of working on this diet, that I could reduce the blood sugar levels to normal, and they came down dramatically. They came down, so within about 3 weeks, I was off all medications. I was only diet and exercise, and the results of the blood tests after a few months of that were that my blood sugar levels had come down to kind of non-diabetic levels.
That's incredible.
Is Kieran's story unusual in terms of, the testing? Because we were talking before we came on air. Is it the levels of testing and deeper testing that's required?
Yes.
Because Kieran's curiosity was what eventually led him to
absolutely.
his diagnosis.
And it's further complicated by the fact that often for people who have NAFLD, who have actually liver damage, so the smaller cohort of people who have this NASH aggressive form of the disease, the liver function tests can be normal in up to 80% of people who've got liver damage. So we say to the GPs, look, if you have somebody with type 2 diabetes and you do liver function tests and they're normal, don't be reassured by that. You have to do a little bit more, because in a cohort of people, not everybody, but in some, you will have liver damage despite the fact that the blood tests are normal. So you need to do deeper testing. And that can be done by scans.
And we have Suzanne up on the screen there, as you can see. Just tips in terms of healthy liver. Tips for a healthy liver, reducing your alcohol, maintaining a healthy weight. I mean,
That's
avoiding
the critical
fat.
one. I
Yeah.
think,
Why
Kieran's
fad diets? Is it because your blood sugar level goes up and down or something?
which is not particularly healthy. But I think what Kieran's story particularly shows, which is what we've seen from clinical trials in NAFLD, that if a person who is a little bit overweight and has diabetes that's not well controlled, that if you lose between 7 and 10% of your baseline body weight, like sensibly over time, up to 80% of the liver damage can reverse. And certainly, Kieran's own story would show that, with this, absolutely, that,
Incredible case study
really
for an
fantastic.
AFLD.
Now, it's easy to say lose weight, it's easy to say exercise more, and it's hard to do, we all know that, because it's changing behaviour, but it's certainly, the liver is very, very sensitive in a good way to weight loss.
Where can people get more information? And they should obviously talk to their GP as well if they're remotely concerned.
I think if anybody's concerned, the two simple questions are, if you have type 2 diabetes, is do I have fat in my liver, and is my liver stiff? Is it getting harder over time? Is there liver damage? And then, blood tests can be done initially, and then, as you said, deeper testing from there.
And we have the website address up there, liverwellness.ie. We really appreciate you coming in, Kieran and Suzanne. Thank you for your
Thanks
time
very
this
much.
morning.
Thank you.
Wishing you continued health.
Thank
Now,
you.
after the break, how to look stylish this summer. Fashion is up next.